the Salts Healthcare Discover Series podcast, the podcast for healthcare professionals. Interesting, entertaining, thought-provoking.
Hi, I'm Lee Smith, Head of Product Design and Development here at Salts.
And I'm Amber Davies, User Experience Lead.
So Amber, we're going to be talking about the design team, the importance of design thinking, how our team collaborates with others, and how we need more feedback and user experience within the team.
Yeah, it's been really good to join such a diverse team, both within the design team and the company as a whole. But I know today we're going to chat a little bit more about the design team specifically and our process and how we innovate. So do you mind expanding a little bit on who we've got in the team and how we go about that?
Yeah, of course. So the team has evolved over the last few years. We're a much larger outfit, got 9 team members at the moment. The great bit about our team is it's balanced with lots of different disciplines and skill sets. So we've got team members with all sorts of perspectives, and this helps to be innovative as a team. You've got all these different perspectives colliding, and it helps us to come up with some great ideas. We've got a mixture of design engineers, product designers, industrial designers. We've got people that are biased towards usability, biased towards process and manufacturing. So it is good to have all those different voices involved in making the design decisions. But as a team, what brings us all together is the design thinking philosophy and the understanding that we really do need to find the unmet needs, the issues that really need to be solved. The way we find those insights is through collaboration with others, and we've developed that channel of insights. And with yourself coming into the company, we're performing really well with that. Could you tell us a bit more about your story?
Yeah, of course. So I underwent stoma surgery myself just over 8 years ago now, so it's been quite a while, and I guess without being too cliche, that changed my path in terms of my career a little bit, where it made me appreciate medical devices a little bit more. So I went to study product design at uni and then moved on to working at a design consultancy developing medical devices for healthcare and pharma companies. But naturally, I've always had a passion for stoma care, and I guess combining both my personal and professional backgrounds to help in this field somehow. So I was really pleased to take the role at Salts. I've used Confidence B myself for a number of years, and that was a real game changer for me personally, not just because of the choice it gave me, but because of the kind of help it gave me in terms of alleviating some skin issues and problems with leakage and whatnot. So yeah, I was really pleased to join the team at Salts and focus on really building upon those insights, like you said, not only how we bring them in to the start of projects to ensure that we're solving genuine problems and the right problems, but also continuing that feedback loop throughout the design and development process of both physical products and services, so that we've got that constant feedback loop. We know that we're heading in the right direction, that we're developing the optimal solutions that are not only desirable and solving genuine needs, but are also safe and effective for use too.
Well, we've really noticed that input really accelerating the development process. Designers without that first-hand real-world experience, they're going to struggle a little bit to make the right decisions. But having you part of the design process, along with Andrew, we're able to gain these quick insights, the quick feedback that really plays well into the design thinking iterative loops of build, make, test, and we are able to, like I say, speed up the process of developing products that are innovative. They're fundamentally better than what's gone before, not just incremental innovation steps. We're wanting to do far more than that at Salts.
Yeah, definitely. And like you said, we've got estimates on the team within the design team. So we're able to kind of test things out, give insight, give input quickly. But I think it's important that we highlight that although we have estimates on the design team, there are only a couple of stories. So it's really important that we kind of supplement that with wider input. So we've got a great network of clinicians and other patients that we work with and have contact with from day to day and week to week, but we're always looking for new ways that we can incorporate those insights too. So I'm really looking forward to getting stuck into projects. I know we've already got quite a lot ongoing, but there's only more we can do in the future to accelerate those insights and, really meet genuine user needs.
Well, that covers the user experience side that you bring to the party, but let's not forget everything else. So you're an experienced product designer, and you've also brought in the human factors engineering expertise that we used to rely on via an agency, but you're now delivering that into the team, ensuring that we are testing products in a more formal manner, and gaining insight into the usability of the products, making sure they can be used effectively, they're easy to use, they're intuitive to use. There's lots of different angles that you bring into the design team.
Yeah, and I think that's a good thing to highlight. Although as a company, we're really focused on insights and we really value insights, actually it goes much deeper than that. And, human factors engineering is something that we have to demonstrate as part of submitting a medical device. So not only are clinicians and patients helping us gain empathy and understanding for their situations, but they're also really helping us identify risks and areas that we need to improve on in order to submit a medical device and genuinely help people day to day. So Lee, we've chatted about the design team, design thinking, and even our design process, but what's the overall vision and company ethos, and why do you feel like it's important to you?
Well, I think the company ethos is driven by our values of listening, caring and innovating to improve lives. And it fits really well with the design thinking and building that user empathy. We only get that user empathy by listening and actually caring about what we're hearing.
Yeah, and I think, initially when you look at a stoma bag, it might look really simple, and some people can be quite closed-minded in terms of where that could be developed in the future. But actually, when you go down to the factory floor and when you see the engineering team work, you realise that there's a hell of a lot that goes into it, and it's actually quite complex. And, that's just in the physical makeup of it, not to talk about how it impacts the users daily. Like you say, people are wearing these things day in, day out. They've really got to, not just work, they've got to help people overcome all sorts of different barriers that are involved with undergoing surgery and using these types of devices day to day.
Well, that's what makes it so rewarding, isn't it? If we've got a product that's discreet and it performs in an exceptional way that people are happy with, and we've brought these delightful new features to the product, that's what's more rewarding. You and I have both got experience in developing medical devices, some quite high classified devices, but the difference is that this is a device that gets used every day. Devices that we've developed in the past are maybe used in an emergency 1 or 2 times a year. This is different. This has the capability or the potential of really improving lives.
Yeah, definitely. And you and the team recently were involved in developing the new Confidence B urostomy. Have you got any examples of how maybe insights helped inform any parts of that project or change the direction of that project at all?
Sure, there's quite a few actually, and one that stands out for me, and it stands out because of how powerful the feedback was the design team really listened to the need for a more discreet night drainage stand, and there's also other stakeholders involved in the process, and we knew from what we call voice of the environment that we needed to do better with the packaging. We needed it to be more sustainable.
Yeah.
And what's better than actually giving packaging a new lease of life so it doesn't go straight back into the recycling streams. There was a decision to look at the packaging and allow users, if they want to, convert that packaging to a discrete stand. And we've had reports that people quite like the option of doing that if they're going away for the weekend or just using it on a temporary basis, and it gives them that extra level of discretion. Some of the feedback that we had from a particular user, it was a lady that reported that she's actually got back into going to music gigs with her friends. She stopped doing that. She really enjoyed sharing rooms at the weekend and going to the gigs, but she stopped doing that because she was very conscious about her friends seeing this night drainage bag out on the side, and she was too embarrassed to put it bluntly, too embarrassed to carry on with that. Now she had the new package or the box that converts. She's now going back out and enjoying life with her friends, going to the music festivals.
Yeah.
But it's that there was quite a few in the team that were, let's put it bluntly, crying when they got that feedback, and that was unique to me. I've not actually witnessed that off the back of feedback.
Yeah, and I think it's really nice to receive that feedback, isn't it? And like you say, feel it as a team, because it really gives us that drive to continue developing and improving for people like that.
Yeah, it's very motivating. We've got lots of exciting projects in the pipeline, lots that we can't quite talk about yet, but it does sort of motivate the team to think beyond the norm, think beyond the status quo. And like you said previously about there's conventions, that there are mindset in the industry where people are locked in on certain rules or observations, and we as a team like to challenge those old ways of doing things and find new issues to solve. I mean, what we don't want to be doing is just making changes for change's sake. We want to find the things that really are a pain. We look out for friction points, things that are just awkward. I find it really interesting because if you go and talk to patients and nurses, they can give you an idea of what areas to look at, but it's the observation side that I really like, where you actually spot people doing things that they don't realise they're doing, or experiencing issues or inefficiencies that they don't realise they've got. They just learn to overcome them. If we can spot those then and do away with those, that then spawns new innovation and gets us away from just doing Me Too products. Not that Salts has done that, but there are plenty of companies out there that do Me Too products. We're different.
Definitely. And I think, like you say, we're quite guilty, all of us sometimes, of saying things differently to how we're actually doing them. So getting out and about and observing people in situ is incredibly valuable, isn't it? And I think I'm always surprised by how much more there is to always learn. We always think as a team we've got quite a solid understanding of patients, clinicians, our general user groups, but actually there's always things to learn about how they maybe have little workarounds, or how, you know, things could be improved, or whatever it is. That always surprises me.
Yeah, and as designers, we do become very focused on certain solutions and take a lot for granted. So it is very important for us to gain this collaboration and test new ideas with people that haven't seen these designs before. If we've been staring at a design too long, we can miss things ourselves. And so we've got to get these iterative loops to find out what we're getting wrong, reduce the risks, and make sure that we're on the right route, that we're spending our time, investing our time in the issues we're solving.
Yeah, definitely. And I think we've baked that into our design process, where we're constantly touching base with those users and gaining their feedback so we can make those small incremental changes.
We've talked about the user experience and the insights and how important that is. Let's talk a bit more about HFE.
Yeah, so the human factors engineering side is a big side in terms of the regulations and the things we have to do to submit a medical device, like we touched on before. But, you know, and it's all about proving that our devices and designs are safe and effective for use. So clinical and patient insights can be really, really helpful in helping us identify those areas of risk, maybe, so that we can look at those a little bit further and really design those out so that we know our designs are not only desirable, but truly safe and effective too. But I think we've touched plenty on the heavy design and engineering side of things, but I think the word human is really, really critical in that acronym. I know Salts as a company, we're really, really family orientated, and we're really all about people. And I definitely feel that as a user and in the services and devices that I use. And I know as a design team, we're really, really strong on that too, aren't we?
We are. So we've talked about insights and the importance of digging deeper into what the unmet needs are. So we actually start projects with a real good understanding of what the problem is that we need to solve. And then we move on and create lots of different ideas and go through a process of looping around, checking and refining certain projects. But what's really important is actually getting that final solution, or what we believe is the final solution, into the hands of people. That will help us understand whether we've actually designed the right product.
Yeah, exactly, you're right. And ultimately, there is a seriousness to it in that everything we develop has to be safe and effective for use. So, like you say, that final part of the process is proving that. And we can only do that by getting users involved, whether it be clinicians, patients, carers, whoever we intend to use that device. It's all about really, really understanding if they are using it as we intended, and if not, how are they using it? What are their behaviours? What instructions do they need? How are they responding to it psychologically? I think that's definitely the part that really, really interests me. And I think
there's always surprises, isn't there?
Yeah, exactly. And that keeps things exciting for us. And we can, at that point, either decide to take things right back to the start, or maybe it's that we start looking at instructions and packaging and other ways that we can help supplement the device that we've developed.
And that's part of our process, isn't it? An acceptance that we will get things wrong. And this is the whole design thinking philosophy, that we need to be prepared to get things wrong. If we're getting things wrong, we're learning. Fail fast, learn quickly. And if we have made mistakes, then let's just see that as a learning opportunity and go back around the loop. And that's how we actually hone in on the right solutions that we know are going to be helpful and improve lives.
Like you say, although when we get patients and clinicians involved, it's always nice to come back to them with a finished product or final solution. But in reality, that's not always the case. Although they can help us identify really solid problems and genuine needs, we don't always develop the right solutions. So like you say, it's always about constantly feeding back, learning from them, testing.
Well, we're very conscious that nurses are giving us a lot of quality feedback and the insight. We can't always share every solution that we come up with. It's quite a competitive market, and there's certain protections that we need to go through in terms of protecting the inventions, and there's set points in which we can share what we've been up to. Those are the exciting points for me, is where we can actually prove that we actually were listening with the help of the clinicians, got to a point where we're really proud of that solution. And that's an exciting part of the project, where you can prove you've actually been busy doing something and not just sat there listening.
Yeah, definitely. It can be a long old process, can't it? But it does help us ensure that when we do launch something, it's the right thing.
We are having lots of conversations, and it's nice to have the variety of voices coming in from patients, from nurses, from our own UK market, the home markets, but also globally.
Yeah, definitely. And something that always surprises me is that no matter how many conversations we have with patients, clinicians, and general user groups, there's always something to learn, whether it's behavioural, psychological, physical. There's always something we take from those conversations.
And this is what keeps things exciting and keeps us motivated to carry on innovating to improve lives.
Thanks for listening. If you enjoyed it, please hit subscribe or the follow button now, and the next podcast will automatically go straight into your library. And if you have any ideas for future subjects, please email hello@salts.co.uk.